I'm Dr. Anisha Ganguly. I'm the Health Equity Fellow for Parkland, and I work in the Center of Innovation and Value for Parkland. Equity is something that's part of the fabric of everything that we do at Parkland. Every act of medical care or patient care that we do at Parkland is embedded with equity. Equity means meeting patients where they're at and delivering care in the way that patients need it the most, at the time that they need it the most, and in the circumstances where they need it the most. It means going out of your way to deliver the type of care when patients may have barriers accessing care, when they may need special support, and getting the appropriate care that they deserve and that they need. Equity is part of my job in two ways. I work on equity for the Parkland system in my clinical care and also in my research and systems projects that I do in the Center of Innovation and Value. As a clinician, I work as a general internist at the Bullet Flowers Clinic. So that's one of our Parkland COPCs. I think it's really amazing that Parkland has our COPCs that delivers care where patients are at. So patients don't have to come to us, we come to them. In my clinical care, the sort of aspects of equity that I deal with all the time are social determinants of health that impact patients' ability to get the care that they need. We have such a high volume of uninsured people here that have no other means to get care. And the fact that Parkland has a mechanism for getting coverage for those people, that's the large bulk of what I do all the time. You know, the fact that we're able to give primary care to people who are uninsured is truly extraordinary, and it's moving the needle for equity and towards justice for those patients that otherwise wouldn't have that sort of access to care. The other aspect of equity that I do in my work is related to my research, and my clinical practice really informs my research. You know, being on the front lines in the clinic, I see what sort of challenges patients face and what sort of barriers sometimes society and our policy has dealt them. So some research projects that we're really proud of that I think really exemplify equity, for example, is Annie's Place. Annie's Place is a child care facility for Parkland patients to drop off their children and get free child care services that are integrated in the health system while patients are accessing medical care. So that's kind of like a revolutionary concept that Parkland thinks that childcare is such an important health need that we're willing to provide that for patients so that they can get the care that they need. I would say few people sleep better than I do because I get so much satisfaction from my job. Every project that we launch, I truly believe moves the needle towards justice for people that need it the most. No matter what type of intervention I'm doing in my clinical practice or through my work at the system level, I know that's going to better the lives of patients that really need the most care.